Hello, everybody. It's April 1st, and we're entering into a brand new quarter, brand new month. Really excited to start our second quarter and really helping changing a lot of lives. Our first quarter was really busy. Coming into 2026, we had a really busy few months, changing a lot of lives. But one of the things I want to talk about today, as we're on a new month, is people don't care how much you know until they know how much you care. What that means to a doctor, surgeon, dentist, dental implant surgeon, whatever, is that there's some successful traits, and I'm probably going to outline 6 or 7, 7 to be precise. That what does it take? What do patients want? And then again, it could be pretty subjective, but I'm looking at it from an objective standpoint. What do patients want in a doctor? So the seven traits that I feel are important is, first of all, be a good listener. Now, communication is a two-way street. I speak and you listen, and you, the patient or whoever it is, speaks and I listen. Now, when I listen as a doctor, I have to listen to acknowledge and understand what the patients are saying versus what I want to say. And because I got the x-rays in front of me, I got the 3D scan, I got the pictures, I'm the expert, but I'm not listening to what the patient is saying and what the patient wants, the outcome, right? Obviously, I'm going to guide them and I'm going to tell them, but I got to listen, and the patient's got to feel that the doctor and the team is actively listening and taking notes about their medical history, their past medical history, their medications, their allergies, their past experiences that may not be. Listen, your patients will tell you. When they tell you, they just want to be heard. Number 2, be consistent. Be consistent in your effort. Be consistent in your coming to work on time, making sure your team come to work on time, making sure your outcomes are delivered on time, your surgery is consistent, your results are consistent. Be consistent. If you're consistent, your results are going to show. I've always said, we have team meetings, I've always say, guys, how you do one thing is how you're going to do everything. So if you do small little things right, it's going to translate into bigger things, and your patients will see it. So that's what patients are looking for, consistency, right? Number 3, showing up. Everybody has life outside of the office, outside of the practice and so forth. And we all have challenges, ups, downs, sideways and so forth. But the key is that you leave everything back in that door. And when you're here, you focus on that patient, because that patient needs you. That patient has trusted you and your team. That patient needs you. Take care of them and show up 100% right there and then, because the patients will feel it. If an outcome doesn't go as you plan as a doctor, or there's some things you want to correct, make sure you correct it for the patients. Make sure you get it done and let the patients know why it needs to be done, so that way a patient understands. It's that communication gap. Correct it if something needs to be corrected. Number 5, make your post-op calls. Call the patient. Have you or your team call the patients the next day, because when you do a surgery, patients sometimes may not be able to articulate, because they may feel awkward calling the office. When they hear from you, when they hear from the team, they really feel comfortable. They feel comfort. Comfort is very important. Then the patient's like, okay, they reached out. Sometimes they'll have a question. Sometimes it's something simple. They think that I should not have called, but the fact that you call as a doctor or your team call, they're gonna appreciate that. Okay, be on time. Number 6, be on time. Now, doctors are notorious for running late, and look, we are also busy dental implant practice. And we understand there are times we run late. It's part of what we do, but we want to give undivided attention to every single patient. But we are diligently working on making sure that we as a team, I as a doctor, run on schedule. Whether I have one patient for the whole day for the surgery, I have multiple surgeries, or have smaller appointments, it doesn't matter. We're going to make sure that we're consistent. We're trying to be run on time as much as we're working hard on attaining that. Last but not least, support your team, because it's a team sport. Dental implants, full mouth implant dentistry, dentistry, medicine, it's a team sport, guys. You can't do it alone. Without your team, without your treatment coordinator, without your surgical assistant, without your anesthesia team, without your lab support, without your lab support manager, without your team liaison, you cannot do this alone. Without your patient advocates that take the patient call, you cannot do it. So support your team, listen to your team, and give feedback and coach them every step of the way. And if they have something that can create efficiency, listen to them, because they're there to help you, and vice versa. So hope this video resonated well. We're looking forward to taking care of lots of patients in April and into the second quarter in this 2026. And hope everybody has a great Easter holiday coming up. And we're happy for all the smiles we created right before Easter holiday and Good Friday. And we're happy to see some of their pictures if you guys post your pictures online about your smiles that we delivered. So have a great evening.